We're now live. You can proceed.
Thank you so much for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communication staff for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Supervisora Hopkins.
Thank you so much, Gilbert. I'm Linda Hopkins, Supervisor for Sonoma County's 5th District and Chair of the Board of Supervisors. Welcome to our special COVID-19 and vaccination news briefing for Monday, March 15th. The topic for today's news briefing is Sonoma County's long-awaited move into the red tier, which officially took effect on Sunday. This means, for example, that our restaurants can open indoors to 25% capacity or 100 people, our stores can open to 50% capacity, and even our movie theaters can open to 25%. It's also good news for reopening schools. This is a first for us, as we have been stuck in the most restrictive purple tier ever since the governor announced the creation of the Blueprint for a Safer Economy back in August. So I want to thank and congratulate all of my fellow Sonoma County residents for their hard work in getting us to this point. This achievement is more evidence that we are gaining the upper hand in this long battle against COVID-19. To help us recognize this moment, I'm very pleased to recognize our distinguished panelists today, including Congressman Mike Thompson, Congressman Jared Huffman, State Senator Mike McGuire, State Senator Bill Dodd, Assemblymember Jim Wood, Assemblymember Cecilia Aguiar-Curry, and Assemblymember Mark Levine. We are also grateful to have a number of our local mayors with us today, including Mayor Chris Rogers of Santa Rosa, Mayor John Moore of Katahdi, who is vice chair of the Sonoma County Mayors and Councilmembers Association. And I also saw Mayor Logan Harvey from Sonoma here as well. But without further ado, please let me welcome Congressman Mike Thompson and Jared Huffman. And I will turn the virtual mic over to our Congressman.
Well, Supervisor Hopkins, thank you very much for doing this. It's important, and congratulations for being in the red tier. Congress has passed the American Rescue Plan, or the COVID response, COVID relief bill. And I think that's important news to all of our constituents. It's money for a vaccination program, increases doses, and puts in place a communications program so people will know when, where, and how to get their vaccines. It increases testing and tracing. There's a financial component. Stimulus checks are already in the mail. $1,400 per person makes under $75,000 a year. Unemployment has been extended. The COBRA healthcare package has been passed. So there's fully subsidizes COBRA if you've lost your job. The earned income tax credit's been increased, and the child tax credit has been expanded. There's money in this to reopen schools. There's money in this to help businesses. And in particular, there's specific money to help restaurants who, as we all know, have suffered disproportionately in all this. And there's critical money for state and local governments to make sure that they can keep their employees on to provide the services that we all need. We've come a long way. It's really important that we remain vigilant, and we continue to take all of the protective measures to get us through this terrible COVID and get us fully back on track. We've come too far to slow down. So stay vigilant. Let's keep this going. And again, thank you. And I'll turn it over to my friend and colleague, Jared Huffman.
Well, thank you, Congressman Thompson, and thank you, Supervisor Hopkins. I'm really honored to join other Sonoma County leaders today to mark a major milestone and to welcome some very good news. The milestone is a grim one, of course. It's been 1 year since this pandemic turned our lives upside down, and there has just been so much loss and disruption and hardship over that year. It has challenged all of us individually and certainly as a community. And I just want to add my personal gratitude to those that we counted on week in and week out, our healthcare workers, public health officials, first responders, grocery workers, all of the other essential workers people who put themselves and their families at risk to continue showing up and help us get through this difficult time. But after a year of this pandemic, we're finally getting some of the good news we've been so hungry for. And today, of course, Sonoma County is moving into the red tier, opening access to more activities and places, bringing us a step closer to normalcy. That wouldn't have happened without a huge effort and a lot of good work throughout this community. So congratulations. And I'm also proud to join Congressman Mike Thompson in reporting that our federal government is stepping up to make even more progress possible. Over the past year, Mike and I and our colleagues have never stopped working to pass relief. We've even had some hard-won bipartisan victories, but there was too much gridlock and politics and confusion, including some of our colleagues who just did not appreciate the real hardships that most Americans were facing and continue to face. It became clear to us months ago that those first few bills we passed, as important as they were not going to be enough to crush this pandemic and meet the moment. And I'm so grateful that President Biden understood this, and he made defeating the pandemic the central focus of his first 100 days. We have been working with the new administration for weeks now, and I am tremendously glad to be able to say, not just that help is coming, but help is here. Congressional Democrats have made good on our promise to deliver relief to the American people that meets the urgency and the magnitude of this crisis. And last week, we sent the president the American Rescue Plan, got it to his desk, and he promptly signed it into law. And it's such a remarkable victory for all of us. A historic relief package that was pulled together in record time, exactly what I believe the country needs. Mike described many of the most crucial elements, but what this is going to do in simple terms, it's going to put vaccines in arms. It's going to put kids safely back in school, put money in people's pockets, and put people back in their jobs. Give you a little local context. Sonoma County is going to get over $95 million. The cities and the county are finally going to get the help that they have been needing for a long time now, and they're going to have maximum flexibility in sending it to meet the highest needs here locally on the ground. Some of this relief from the American Rescue Plan is already out the door to communities all over the country. You're going to start seeing the impacts of that very soon. And in fact, some people have already started to receive their individual stimulus payments in their bank accounts. So relief is not just coming, relief is here. And this is great news for Sonoma County. We are on our way to recovery. As Mike said, this is not quite a mission accomplished moment. I think we can appreciate all of this progress without letting our guard down. So please do continue to follow health guidelines, be careful. And if we can do that for the next couple of months, we really will have crushed this pandemic, and we can celebrate the biggest milestone of all, a full return to normal. Thanks very much, and I'll hand it back to you, Supervisor Hopkins.
Thank you so much, Congressman, and thank you so much for your tireless work on the American Rescue Plan and for so diligently representing the interests of Sonoma County residents. In local government, we really look forward to getting that money out the door as quickly as possible and into the community and for the stimulus that is so desperately needed. So thank you so much for all of your fantastic work. With that, I would now like to hand the virtual mic over to our state senators, Senators Dodd and McGuire, and then on to Assembly Members Wood, Aguiar, Curry, and Levine. And I want to say thank you to our Assembly members. I know they have a tight timeline right now because they're actually having to go in and take a vote in about 20 minutes. So thank you for being present with us while you can. Senator Dodd.
Chair Hopkins, I believe our senators are delayed right now, so I think we can go right to our Assembly members at this point.
Okay, wonderful. Assembly Member Wood, are you available?
I am. Thank you so much, Supervisor Hopkins. Appreciate the opportunity to be here. As a healthcare provider, health equity is something that's really important to me, and I'm proud of the fact that we set a goal of getting 2 million vaccination doses into the arms of people in some of the most vulnerable neighborhoods that have been hit hardest by COVID-19. We've reached that, and that goal, combined with the work Sonoma County has done, the public health department, public, local businesses, individuals out there, has allowed us to move into this red tier, which is a really, really big deal. I've been a volunteer at several vaccine events, and I've seen the outpouring of emotion and relief as people get the vaccine, and rightfully so. They're not only helping themselves, but they're helping the community to get to a place we've missed for more than a year now. Of Sonoma County's eligible residents older than 16, 28% have now received at least one dose of the vaccine, while nearly 12% have been fully vaccinated. And now that vaccines are becoming more readily available, we should encourage our family members to get the vaccine whenever they can, no matter which vaccine. Seriously, they're all amazing feats of medicine. And as soon as one is available, you should grab the opportunity to do it. We all want our kids back in school and our businesses to be able to reopen. I, for one, want to be able to see, as the weather improves, to be able to get outside and dine outside and visit many of our great breweries and wineries and so many businesses that have suffered under this. I will, and I encourage everyone to not let their guard down, though. We're not through this yet. Continue to wear your mask in public, social distance, wash your hands, and get the vaccine. We can all contribute to making progress together and get to the next tier and watch this virus go away. Well, thank you once again, Supervisor Hopkins. Really appreciate the opportunity.
Thank you so much, Assemblymember Wood. Assemblymember Aguiar-Curry, would you like to share some thoughts?
Sure. Thank you so much for having us. And I'm sorry, the Assembly members are kind of rushed because we have a bill we have to go vote on. But, you know, several weeks ago, Governor Newsom proposed a bold COVID relief package, echoing the key themes of the Biden-Harris American Rescue Plan to provide critical financial help to families and businesses in need. And when I think of that, I think of thank goodness for the leadership that we have in Congress, Congressman Thompson, Congressman Huffman. I truly appreciate, and I wish I could give you both a big hug to thank you, because it will change the lives of so many of our constituents. And I also would hope you would pass it along to, considering we're celebrating today Women of the Year at the state capitals, please pass this on to our Speaker, Speaker Pelosi, and all the fine work that all of you have done to make our lives hopefully better. You know, a couple of things that we're working on here is that we continue to support small businesses. There's more, for more small businesses and nonprofit, we have some grants. There's tax and fee relief focused on small businesses. So we really kept an eye on that. And right now we're voting on a bill downstairs that will affect some of our small businesses, and continue to support our individuals and families. The Golden State stimulus plan payments focused on low income workers, we've got a lot of those passed through. But most importantly is that I want to congratulate Sonoma County for getting in the red tier. That's fabulous, but we know that we can't go back. And we need to encourage everybody to continue to do what they've done in the past. You know, there's plenty of people that have been vaccinated. And I will say, I'm 66, I am vaccinated. And I feel like a big weight is off my shoulders. And I want that big weight to be off of all of my constituents as well, to be able to get that taken care of. But we got to remember, just because we're vaccinated doesn't mean that we're free and clear. We still need to wear a mask. We still need to take the precautions. We still need to wash our hands. We still need to do all those things that, even if you were not vaccinated, we need to take care of all of our constituents. So please remember, all of you online, is that your leaders in your county and cities want to get the businesses back open. We want to make sure the schools can get reopened if they're not already. And it takes just one of these, a mask, that really can make the change for so many people. So thank you very much for having us today. And I look forward to any conversations we might have or questions.
Thank you so much, Assemblymember. And I just also want to say thank you, and also Assemblymember Wood and Assemblymember Levine. You have all been consistent champions for small business, and really appreciate your advocacy at the state level to make sure that our small businesses can make it through this pandemic. With that, I would hand it over to Assemblymember Levine to hear his thoughts.
Thank you very much, Chair Hopkins. Thank you for your leadership, the entire leadership of the county, as well as County Public Health, who have just been stewards for our community to get us to this very good day. And following up on the wise words of my colleagues about being careful as we get into this reopening, I want to say thank you to both the congressional delegation, but also my colleagues for helping us pass legislation that will really help hardworking Californians get through this, as well as nonprofits and businesses with the Golden State stimulus. And of course, the billions that we've put towards our schools to get them to reopen. We celebrate a day like today, but we know that that doesn't change that lives have been lost. It doesn't change that livelihoods have been upended. It doesn't alter the fact that children have had a very challenging year learning at home, but that we know that things are changing. We have vaccines now. And so some friends here who have been vaccinated, it feels like things are working when I know that my parents have been vaccinated. But if we look at Sonoma County, only a third of us have been vaccinated. There are 2/3 that we still need to get vaccines to. And we need to be patient and be very careful until we can vaccinate everyone. It feels good to know that children are hugging their grandparents again and that they're going back to school finally. But let's not screw this up. People are still dying of COVID today. It's unfortunate to say, it doesn't feel good to say, but let's be careful. We don't want our schools to close down. We don't want this marvelous, wonderful reopening of our businesses and economy to have to shutter again and go through this pain. We can get through this. Let's just be careful. Let's measure our risk. Let's take precautions and be very careful so that we can have a really great summer ahead. Thank you very much.
Thank you so much, Assemblymember Levine. Great thoughts. Paul, do you know if our senators have been able to rejoin us or if they are still otherwise occupied?
They are caught right now, and so they'll join us if they can. So I think we can move on to our mayors right now.
Wonderful. We will welcome them if they are able to drop in later. So with that, I wanted to help shed some light on how the change to red tier is impacting the daily lives of residents and our businesses. And I think that there's no better person to speak to that than one of our fantastic mayors here in Sonoma County. So with that, I'll introduce John Moore, Mayor of Katahdi.
Thank you, Supervisor Hopkins. It's great to see all the elected officials, and I thank you all for the tremendously hard work that you've been doing, both on the federal level and on the state level. On the city levels, we are trying to reach out to our residents to encourage them to follow the directions and to stay safe. We are offering as much information as we can, and we're trying to act as a conduit for any of the business services that may be available out there. And of course, really trying to encourage them to follow the strict safety protocols so that we can keep this in the red and actually eventually go to the orange and yellow. So thank you so much.
Thank you so much, Mayor Moore. I really appreciate that. I know that you guys are on the front lines, are trying to support your small businesses and get the word out to your constituents. In addition to everything that you've already heard, the fantastic news from our state and federal representatives regarding relief that's on its way, I do also want to note that the state last week tweaked the red tier to allow wineries and breweries and distilleries that do not serve meals to open outdoors with limitations, which is welcome news for many of our local business establishments. But it's also worth mentioning, as several of our other elected officials have already stated, let's not overdo it with celebrations, especially with St. Patrick's Day coming up on Wednesday. The last thing that we want to do right now is to experience another surge like we did after the holiday gatherings. We do not want to slip back into the purple tier, which would be devastating, I think, for many of our small businesses who have just put so much effort into reopening safely. I'd also like to remind everyone that while we are grateful to finally be out of the purple tier, moving into the red tier, that's not our ultimate goal. Our goal is to get into the orange tier and then to yellow, and ultimately to put COVID-19 well behind us in the rearview mirror. Our goal is also to make sure that we are getting vaccines into the arms of our most vulnerable residents, which includes not only our most senior residents, but also our essential workers, like our food and ag workers, our restaurant workers, and those by virtue of their jobs or their living situations who are put at risk on a daily basis. Our Latinx residents represent 27% of our population in Sonoma County, but they also represent the majority of those who have been hit by the virus. So far, unfortunately, they only represent 17% of those who have received vaccines. That's just not good enough. So we're going to continue to push to make sure that we administer vaccines to those communities most disproportionately impacted by COVID-19. We will also be encouraging Blue Shields, our third-party administrator, to ensure that this is an absolute priority here in Sonoma County. Finally, before we turn to questions from our media partners, I would like to ask Dr. Mace if she would give us a quick update on where we stand with respect to our metrics and the vaccine rollout. Dr. Mace?
Yes, thank you so much, Chairwoman Hopkins, and to all of our distinguished panelists who are participating today. Let me give an update on our metrics. We're doing really, really well. Our adjusted cases per day per 100,000 residents is now 6.8, as low as it's been in the past 9 months. and our positivity rate is down to 2.5%. Notably, our testing positivity in the lowest quartile of the Healthy Places Index is down to 3.9%. And that is the lowest it has been since we started tracking this metric. This means that we're making great progress in stopping the spread in our most disadvantaged neighborhoods. On the vaccine front, we're seeing a slight uptick in the number of doses that we receive from the state. This week, we expect to get 8,600 doses, but the majority will be used for second dose appointments. In fact, I think only 800 of those doses are reserved for first dose appointments. Overall, we have administered 185,804 doses in Sonoma County. This means that more than 31% of our 16 and older population has had at least one dose. As of today, anyone 16 and older who has a comorbidity or an underlying medical condition, as recognized by the CDC, is eligible to receive the vaccine. However, as we've been saying for the past several weeks, the vaccine supply continues to be very limited, and appointments will be hard to come by as a result. So I just want to ask everybody to be patient. While we're making this kind of great progress, we're still months away from achieving herd immunity. With COVID still spreading in our communities, we must continue to practice the safe measures like others have mentioned in this briefing. The wearing of face coverings or masks is extremely important. Social distancing, general hygiene measures like hand washing and wiping down surfaces. And we must continue to get tested so that we can see where the virus is spreading and avoid outbreaks. I encourage everyone to get tested when you can. And as I've said before, the other advantage of getting tested, besides finding people who are asymptomatic or minimally symptomatic that have COVID, is to actually give us a better adjustment factor from the state that rewards us for increased testing. Our latest adjustment factors have been somewhere around 0.8 or so. At the height of our surge, however, in December, we were able to achieve an adjustment factor of 0.5 or 0.6. And if we were able to do that once again, that'll be the sure path for us to get into the orange tier. And as everyone has said already, please, everybody, do abide by the mitigation measures, because we want to stay in red, we want to move to orange, and we want to move to yellow. We do not want to move back to purple. And if everybody does their little bit there, I think we can continue this wonderful progress we're making. So thank you very much, Chair Hopkins.
Thank you so much, Dr. Mace. And I understand that Senator Dodd might be available right now for a couple minutes. Senator Dodd, are you there? Just waiting. I thought I received a message. So Supervisor Rabbit, do you have any update? You were the one who let me know that he might be available. Oh, I see him coming on.
Here he is.
Perfect. Wonderful. Senator Dodd, you have impeccable timing. You've got the floor now to share a few thoughts if that works for you.
You're on mute, Senator Dodd.
You would think by now, wouldn't you, Congressman?
You would think by now.
Absolutely. Well, it's just great to see everybody's face. So many of you that I haven't seen in so long. I appreciate the opportunity to be here today. And I'm really, really thankful that Sonoma County is in the red tier. And I'm anxious that perhaps things that we will talk about today will help us quickly get to the orange tier as well and not backslide. But it's been a difficult few months, especially for our small businesses and students. That's why California has sent out hundreds of millions of dollars in business aid and tax deferrals and reserved vaccine doses for our educators and school staff. We all know that our local economy has a long way to go, but the state will be there to help. Even though we are headed in the right direction, we must not let our guard down. We all know that. Continue to wear masks, socially distance is absolutely critical, even if you're fully vaccinated. Remember, masks don't only protect you, they protect everyone around you, including those that have not been vaccinated. We're working hard on getting even more vaccines to our communities, especially the places we have been hit the hardest. But equity must guide all of us in our efforts. The pandemic does not end in your community, it ends in every community. We can see light at the end of the tunnel, so let's remember to stay vigilant and stay hopeful. Health is on the way. I really do want to thank the Board of Supervisors, Supervisor Rabbit, Supervisor Hopkins, and Congressman Supervisor Gorn. I'm sorry I didn't see you there. Great to see you too. And Congressman Thompson and others on the call. This is very important as we move forward. And I just appreciate the opportunity to be on. I'm headed to a committee hearing, and Senator McGuire is worried about getting here, but he said he would come out. He's got a meeting he's at right now. So thank you all very, very much.
Thank you so much, Senator Dodd, for sharing your thoughts and for all of your tireless work on our behalf of the state of California. With that, we will certainly give Senator McGuire the mic if he is able to drop in. But for now, I'm going to hand it over to Paul to take questions from our media partners.
Okay, well, thank you all. We have quite a number of followers and some comments. We also have some questions from our media partners we'll get to. First, I will start with a question from Lee, one of our viewers on Facebook, who makes the point that vaccine availability, despite the progress we're making, that vaccine availability is nowhere near where it needs to be. He makes the point that it's going to take many, many months at this rate to get everybody vaccinated. What I guess the question is what hope is there of us getting seeing a real boost in our supply?
You know, Paul, I'll speak to that. We've
Great,
seen a
thank
real boost in our supply, and we'll continue to see that. The bill that Jarrett and I just voted to pass, that's been signed into law, provides a tremendous amount of resources to do just that. And it's to increase the supplies that are necessary. It's also to put together a national coordinated plan to be able to communicate. There'll be an effort by FEMA to help administer the vaccinations. You're going to see mobile units that will do vaccines in remote areas. You know, 3 months ago, we didn't even have a vaccine. And now the president mentioned just last week on over the weekend that in his announcement that he's hopeful that every adult who wants to receive a vaccine will be able to do so by May. So we're making pretty good headway. Now we all have to join this fight and make sure that we do everything within our power, as everyone on this Zoom has stated, to slow the spread, wear your mask, wash your hands, socially distance, be smart, be considerate of your friends, your family, and your neighbors, and we'll get through this, and the vaccines will be coming. You know, there's a third vaccine now on the market with the J&J vaccine. They've partnered with Merck. Merck's going to help them increase production. So you're going to see a steady increase all the way. And I second what Assembly Member Wood said. If you get a chance to get a vaccine, get it. Don't product shop. They all work. They're all going to be helpful.
Paul, I will just add, I agree with everything Mike Thompson just said, but you know, we just in the past few days hit another big milestone, 3 million people vaccinated in a single day. You may remember that President Biden said his goal for the first 100 days was to make it 1 million a day to try to achieve 100 million. We are way past that. We're blowing past it. And I expect that pace of vaccination is going to continue to move up. In terms of the actual supply of vaccine, which, you know, the question is right, that is the key limiting factor right now in our ability to go further and faster. You know, you are seeing manufacturing capacity increase. You're not just seeing contract options exercised. You're not just seeing new contracts executed, but you're actually seeing manufacturing capacity brought online because we're finally using a law called the Defense Production Act the way it was intended in a moment like this. You're seeing pharmaceutical companies that are arch rivals working together to manufacture the other guy's vaccine. That doesn't just happen, you know, out of goodwill. There's a lot of leadership and arm twisting that's underway very actively at the federal level. I don't know if Dr. Mace has seen that rolling 3-week forecast really begin to dramatically tick up quite yet, but it's coming, and we will have the transparency and the accountability to make sure that 3 weeks out on a rolling basis, you're going to see waves and waves of more vaccine come into Sonoma County.
Yeah, I would agree. Let me just chime in to say that that's been what we've been told by CDPH, that Perhaps here in March, there's going to be a little bit of a plateau, but very soon here, we expect to get more vaccine. And as we've said before, in Sonoma County, we could do 40,000 vaccines a week if we had the vaccine.
I also just want to say thank you so much to our congressman. I've been hearing more and more positive feedback just from constituents who are able to secure vaccines through the direct federal allocation to local pharmacies. And so, it's great that we have multiple programs and multiple options. I don't know if you want to share any more information about that, but I'm hearing very good feedback, boots on the ground from those programs. And I also wanted to mention that I didn't mention it before, but Mayor Judah Che from Rohnert Park is also on the line. And the mayors, you're welcome to turn on your videos if you want and take questions from members of the public and the media as well. So I just want to make sure that you're all part of the panel if you like. But Congressman, I don't know if you wanted to add any more about those federal programs that are really having actual real results in the community, because I'm hearing from folks every single day who've gotten vaccines through them.
I don't know if Mike wants to speak specifically to it, but yeah, obviously we've got all these channels that are going to be coming online, and people may need to do a little bit of shopping around, to call those drugstores, to call Kaiser, or whoever it is that they typically get their health insurance from. But another channel, Supervisor Hopkins said, that's really important in hitting our equity goals are the federally qualified health centers, the clinics. And they're going to have their own dedicated federal supply of vaccines to make sure we're not just hitting these targets, but we're doing it in a way that's equitable, and we're serving those non-affluent communities as we go.
Yeah, we've moved beyond help is on the way, help is here. And we're seeing it every day. There's improvements, more outlets for the vaccine, and this will just continue to grow.
We just want to remind everybody that all those options for clinics eventually will be on that My Turn site, but that is not fully activated as yet. And so we do encourage, we do have them all listed on our socoemergency.org/vaccine site. That's socoemergency.org/vaccine, including the CVS sites where there are options for vaccinations. Let's go to our media partners. Let's start with Phil Barber of the Press Democrat. Phil.
Lots of very optimistic predictions and outlook on the vaccine supply moving forward. With all due respect, the fact is that the allocations to Sonoma County have been flat for a month and into the next couple of weeks, as far as we can see. Chair Hopkins mentioned some of those federal supply chains to pharmacies, which it's hard to get accurate information on that, but that seems to be a little more robust right now. Does anybody local or our congressman have any sense of whether there has been a shift in the national supply chain away from states and counties and towards some of these federal programs?
Phil, I'll jump in. I don't think states and counties have seen their supplies reduced in order to fill needs through these other channels. I think what you're seeing is, as new supplies come online, we're trying to support those other channels. So, for example, I know that through the VA, veterans are starting to get the J&J vaccine. That's new and that's additive. And I don't think that's come out of any allocations to state or county folks. And by the way, that vaccine is really ideal for reaching, remote veterans who don't want to have to, on multiple occasions, board that bus and drive all the way to Fort Miley in San Francisco. There's a huge demand for that Johnson & Johnson vaccine, and we're starting to actually get it out there.
Any of the mayors want to add anything? Because I sort of shared my anecdotes of what I'm hearing from my constituents. But if anyone wanted to jump in, I've been hearing more and more folks saying got it through CVS, got it through Rite Aid, and got the J&J, which means they're one and done. So in 2 weeks they'll have that immunity, and they're feeling a real renewed sense of optimism. Any other local government boots on the ground want to jump in?
Yeah, we're hearing the same thing in Sonoma. Definitely, there's more access to the vaccine, and people are starting to get it. It's getting into even some of the younger friends that I have that are in food service or in working in grocery stores, which is really good. And the thing I just keep reminding people is that having this vaccine, we're here a year out from when we first started a shutdown. The fact that we have a vaccine at all is a minor miracle, and it's coming a lot faster. But there's an international demand for these products, and definitely a national demand. And so it's coming. We have the capacity to supply it, and it continues to grow in the amount that we're seeing. So really, really important to stay vigilant, to keep looking through all the different channels that you can get it. But we are hearing more people getting access. And with the J&J, it's a single shot, which is going to be really, really useful and beneficial for our community as well.
Yeah, just to chime in from Roanoke Park's perspective, we're first of all very blessed to have the OptumServe clinic here, and also our Roanoke Park Health Center has been involved in vaccinating all of our food production workers. So the workers over at Strauss, workers over at Morton Bassett, our spice company, workers over at Sonoma Distilling are all in the process of getting their vaccinations, and we're waiting anxiously at my facility as well. And just one quick note is that I sit on a call with all 9 mayors and the Board of Supervisors on a weekly basis, and I think the public should know how well everyone is playing with everyone else in the sandbox cooperative, especially with the county. And last week we got a great presentation from Kaiser and St. Joseph's and Memorial. That was a fantastic conversation that was done by Paul, and so everyone's really working together as a team, and Roanoke Park's just happy to be part of the solution.
Thanks to everybody. If I could ask one more question of our local health officials. The state of California has opened eligibility to people in congregate settings, notably the unsheltered and the incarcerated. Is there any sort of plan yet within the county to vaccinate those populations?
Yes, we're definitely have been talking with both of those groups to find out if we could set up a specific vaccinators, that is, for the unstably housed and incarcerated. In fact, people over 65 in those groups have already been reached out to. Again, I think, Phil, the main thing is the limitation of vaccine now. We have a plan in place to get all these different groups vaccinated if we had the vaccine.
Yeah, and Phil, if I could add, I can tell you already, WellPath at the jail has already started vaccinating individuals there at the housed at the jail. They've started with the oldest individuals there, those over 65. And as we continue to get vaccine supply, we'll continue to supply them. We've been working with jail management to make sure, Sheriff's Department management to make sure that there's a coordinated effort in between health services and the Sheriff's Office.
Great, thanks everybody.
Okay, thanks, Phil. Let's go to Carl Van Amberg from News of the North Bay.
Yeah, hi everybody. Thanks for the opportunity. I wanted to just follow up on what Phil was saying a little bit. Just recently, as maybe a week, 2 weeks ago, there was a lot of frustration on the part of the supervisors and also the health department here locally as to the amount of vaccine flowing into the county, flat at somewhere between 7,000 and 8,000 doses. In light of what Supervisor Hopkins was saying, that other channels appear to be getting more robust, like through pharmacies, things like that, has there been any ability to accurately, quantify in terms of numbers the total amount of shots being given in Sonoma County? People are getting discouraged by hearing 7,000 to 8,000. Can we quantify those additional amounts that we feel are entering the county now? Is that possible?
Well, let me turn that over to Ken. I don't know, Ken, if you, I think you're with us.
I'll share with you anecdotally. We're just watching the numbers come out of CARE, the California State Immunization Registry that shows the total number of vaccines. A few weeks ago, we were ticking up at a rate of about 2,000 to 3,000, about 2,000 a day. On that, and now we're moving more like 4,000 a day. So yes, I am seeing an increase in total number of vaccines in the county. Remember that Kaiser has also received a much larger allocation of vaccines as well, and they're continuing to vaccinate individuals in our community.
So quick follow-up, there are more vaccines, but nobody has really quantified the amount. Maybe 4,000 a day is a a fair figure to say happening right now, according to Ken? Is that something that people can agree upon, perhaps?
If I could get you that number through our epidemiology team, I think it would be better if we could just give you a running average over the last several weeks. I think that'd be better for us.
Okay, super. Thank you.
Hey, thanks, Carl. Let's go to Martin Espinoza.
I think Supervisor Rabbit might have a few things to add about this one. Supervisor Rabbit has a little more information.
No, I appreciate that. And Carl, since you said the supervisors were frustrated, I think that's true. And we've all been frustrated throughout the course of the year, I'm sure at different points in time. We want to get as much vaccine into the arms of Sonoma County residents as possible, as quickly as possible. That's always been our MO. As to Ken's point, I got only, and thank you all for being here, but really thank staff for the amount of work that they've done and the deciphering they've done when they receive the orders. And we just talked about this morning, making sure that they go back those 21 and 28 days from this week to make sure that those who are due the second shot, whether it's Pfizer or Moderna, can receive theirs. It is a Herculean logistical challenge. We look forward to the day soon that the numbers are going to be exponentially more coming into the county as production cranks up, thanks to our Congressman enacting the Defense Act. And that's going to be a challenge that we're easily can rise up to. As Ken has already set up the county for about 40,000 shots per week, and we could probably even push that a little bit, I think, too, Ken. So yeah, there's frustration, but I think it's just frustration that we're all sharing this particular year and just wanting to continue to advocate, continue to push, continue to make sure that we're doing the right things at the right times on all sides. So I just wanted to add that from the supervisor's perspective, and I think I share the mayor's and all of my colleagues within that.
Thank you, Supervisor Rabbit. Okay, let's go to Martin. Martin?
Hi, can you hear me okay?
Yeah, you're good.
So we've heard a lot of talk about equity, both the federal government, the state, and also locally. We've been stuck at 17% of the Hispanic population here vaccinated for, I think, 3 weeks now. We were doing great progress in the beginning. We went from 11% to 15% to 17%, but we seem to be stuck at that. Why is that? And is there a problem with getting this vaccine more equitably distributed here in Sonoma County?
Yeah, I'm going to turn it over to Ken and Denny in a second, but let me just say that it's the lack of vaccine supply. So when all of our vaccine is going to second doses, it's going to be for people who got their shots 4 weeks back, depending on the vaccine. Therefore, we're not able to expand the group that's getting vaccine to the more vulnerable populations yet. And I don't know, Denia or Ken, do you want, one of you want to jump in, or both of you?
I just echo what you said, very, very much so. I believe the reason that the number is staying steady is because we are focusing almost exclusively on second doses at this time.
Denia, do you want to add?
Yeah, I want to echo what both of you are saying. I think it'll be now important more than ever now to really prioritize those hardest hit neighborhoods as we do get vaccine coming in. And that's something that we're going to be focusing on and working with Ken and Dr. Shanda and Dr. Mays to ensure that we continue to give vaccine to those who have been impacted the most and within those HPI lowest quartile census tracts.
I am hearing, though, that constituents are reporting that they're getting the vaccine. We've got mayors who are saying that that they're hearing that people reporting that they are getting the vaccine. I'm imagining that those are first-time shots. Is it that our lowest income or our most disadvantaged population are getting it through the county, and others are getting it, who are more savvy about where to get it? I think that word was also used. Is there a savvy issue here?
And what are your thoughts on that, or anybody who's representing the county who knows about this?
Martin, this is Kate. I just wanted to clarify one point, that 17% or 18%, that is not referring to the percentage of the Latinx population vaccinated. That's referring to how the vaccines that have been distributed so far, what proportion is going to each racial ethnic group. So that is not actually, it's more showing the distribution across different groups, if that makes sense.
It sounds like you're talking about the same thing. I don't get it.
So I guess what I mean is, you know, when we look at the chart that shows the number of people that are in the 75 plus age group, and we talk about the proportion vaccinated, that's going to be a bar that is growing incrementally over time until hopefully that entire group is vaccinated. In the chart that you're referring to, that isn't looking at it's not looking at among all individuals in that population, how many have been vaccinated. It's looking across all vaccines that have been given, what proportion has gone to each racial ethnic group. So it's a nuanced difference. I can talk to you more about it after if that would be helpful.
No, I get it. It's just it's a share of vaccine, and it's 17%. It's a share of vaccine recipients. But you got it compared right there to the 27%. I don't. Is that not a valid comparison? Don't we want to get those two numbers equal, or maybe even more, because they do comprise a large share of our essential worker population?
No, I just want to jump in and say that I think that we do need to do better. And I think that we do need to target this population absolutely moving forward and create targeted clinics with trusted community-based organizations, right, that have relationships with these vulnerable populations. One of the things we were tracking early on, though, was the fact that because we were prioritizing first responders and medical workers, that kind of skewed the data from the beginning, right? So it's not like we opened it up to everybody, but there were sort of these select tiers. So it also was in some ways based on the, you know, sort of gender and age and ethnic demographics of those first tiers that were prioritized. But certainly now that we have opened it up to, you know, more essential workers, I think that really gives us an opportunity to hopefully advance this cause of equity and really target our Latinx population. And again, I think it's going to take partnerships with some of the service providers who also helped us with things like testing and communication. So more to come on that. Dania, do you have anything else that you want to add?
I absolutely echo what you said. We more of developing those, better fine-tuning those strategies and ensuring that we have clinics like in Roseland, right? That has been one of the most impacted neighborhoods, ensuring that we are really meaningfully engaging communities to ensure that we're coming through as we're going to the, we've opened the door to the essential worker category. We hope to make sure that we do a better job in targeting and creating those clinics and the spaces so communities can come and get their shot.
Yeah, and I would agree 100%, Chair Hopkins. The reason things were skewed to start off with, Martin, is because of the phases and tiers and who was included. And then as soon as we were able to go into phase 1B, which included the essential workers, we were quickly making progress, as you pointed out, going from 11% to 17% of vaccine being distributed in that particular Latinx community. However, we're at a standstill due to lack of supply of vaccine.
I think that, I was going to say, Mayor Harvey, I think, had a few thoughts on this from Eastern Sonoma County, from Sonoma as well.
Yeah, I just wanted to say that we're absolutely focused on this issue of equity and been working closely with Supervisor Gorin's office as well at the city to, we have a weekly COVID-19 task force, a Latino task force. We're working with our Latino, our trusted Latinx community organization groups here, like La Luz, Sonoma Immigrant Services, and our health clinic. And so it's definitely a focus, and we're working with our Vintners and Growers Society to reach out to those farm workers as well, to try to get this into the community as much as possible. And just a reminder that this has been a massive lift for staff, and so things have been confusing at the beginning. I think things are starting to level out. We're getting a regular amount of vaccines, and we're holding a lot of informations and informational meetings in Spanish, specifically in Spanish, as well as going through neighborhoods and handing out pamphlets to try to make sure that people are aware of this, because even just seniors that are in our community have had a lot of trouble signing up for vaccines at the very outset of this. So we're trying to get that information out there, and I do believe that over time with these efforts, that these numbers will change, and we'll get to that equity piece, because everybody is working really hard on that one.
If I could just have one more question. Dr. Mace, based on your conversations with other county public health officers, how long does it usually take to go from the red to the orange? When can we expect that for us?
Well, it's a great question. It's the crystal ball question, again, that has come up all year. You know, not many counties have actually gone into orange. And when they have, I think it was sort of November or so when many counties were potentially getting into that, the metrics for orange, quickly they bounced back. So I think, as I said initially when I was discussing this, that it's going to be about getting that case rate of ours down. In other words, we want to go from widespread to a much less transmission going into the orange. And more testing will help us do this. We'll find cases, get them isolated, do contact tracing, quarantine contacts, and test them, and simultaneously get a better adjustment factor. So my advice to everybody is follow the mitigation measures and get tested. And I think that's going to help us.
Okay. Aidan Vazari of the San Francisco Chronicle has asked, could any of the panelists speak on the estimated economic losses suffered by Sonoma County businesses as a result of being under the purple tier for much of the past year, especially combined with the impact of the fires in the region? Would anybody like to take that on for our San Francisco Chronicle?
Well, I don't know that we have any data available on that, but we certainly have anecdotal evidence of what has happened, and it really depends on what kind of business that you're in. The pandemic has actually increased business for some types of enterprises, but we hear all the time about restaurants that have closed, about various types of businesses that are struggling mightily because they can't bring people inside. The restaurant sector is one. Gyms are another. You know, it depends on the type of business that you do and how you do that business. But I'm not aware of any statistical information that we have on this.
Supervisor Rabbit, did you want to jump in on that one? I've also was thinking about all of the economic analyses we did after the fires. I mean, it is well documented that we struggled as a result of those disasters. You know, we don't yet have a quantification for the COVID-19 impacts, but I agree with Supervisor Corsi that it is certainly varied by industry. Supervisor Rabbit, I know you've worked extensively on supporting our local businesses. Any thoughts?
Yeah, no, thank you very much. And I appreciate my colleagues. I think obviously Sonoma County is heavily dependent or has a large dependency on a tourism industry. Therefore, when tourism stops, that obviously has a negative effect on the economy. Some 7.5 million visitors plus visit Sonoma County on an annual basis. So all the restaurants, all the establishments, the hotels, the B&Bs, all dependent upon those visitors, took a tremendous hit. And I think what we all think, I'm sure, is very unusual through this entire pandemic is that on the economic front, some have taken, if you were affected in a negative way, if you were at all dependent upon that face-to-face, that person-to-person contact, that you have taken a big hit. Certainly restaurants have been struggling, and as was mentioned, but everything to do with the tourism industry, I think, has shifted. I will say that our business industry overall has been very nimble in trying to find a niche, and the citizens of Sonoma County and elsewhere have been very supportive of their local businesses, making sure that they're supporting them going forward. But I think as we come out of this and do a report on the economic impacts, it'll be substantial, no doubt, and no doubt in line with what we're seeing elsewhere in comparable counties.
Okay, we're nearing the bottom of the hour, but let's end on one more question from our public viewers. Robin makes the point that it seems like in California and their efforts in the state's efforts to vaccinate the most vulnerable, all the vaccine distribution has been focused on Southern California, and that there's not a single one of the 400 zip codes that were allocated, designated for those 40% allocation were in Sonoma County. So the question is there hope that we may see some of those in the next round of allocation? Will we see some of our zip codes targeted in the next round?
I know we deal with this at the regional level, and it's a strange predicament because here we are wanting to have one of the disadvantaged communities within our midst, and when in fact in California, I think it's all relative to where you live and to the economic circumstances within those counties. We've dealt with this. I know I've dealt with this at the regional level with the 9 counties. I think within the 9 counties, there's very few zip codes that actually comply. You'll find a lot more of them, perhaps in the Central Valley and other points throughout. But I think that doesn't stop the county from advocating in its own way to make sure that we can, while we might have a demographic that is the overall has such a large number within a given zip code, it doesn't mean that there aren't individuals within that zip code who would still qualify and still need to make sure that we advocate for to receive what they need. Not sure if you were leaning in there, Dr. Mace.
Yeah, I could just say that, no, I disagree with you. I totally agree with everything that you said, and I really have nothing more that I could add to that.
Well, with that, I'll turn it back to Chair Hopkins. Thank you all.
And I just really want to say thank you so much to all of our elected officials. I mean, one of the reasons that we invited you all here today is that it has truly been a team effort. And we are not here to say that everything has been perfect or that it's going to be easy from here on out, because we know that there will still be challenges ahead. But we all are coordinating closely with one another. And I can certainly say a huge thank you to our Congressman for the fantastic American Rescue Plan that was just passed. This is really going to be a game changer for local governments and for so many of the people that we represent, our shared constituency. So thank you so much for your work. And thank you to all of our mayors who are also all rowing in the same direction with us, and to our state representatives who I know had to jump off the call early. Congressman, do you have anything to say to sort of, bring us home, send us away?
I'll just say thank you for a great partnership. You guys just do a fantastic job, and you're on the ground. You're right there every day, and it's a pleasure to work with you. And I just want you to know that on our behalf, we'll keep working with you and do as much as we can to make sure that our shared constituents get all the help that they most certainly deserve. So thank you.
Thank you, Congressman Thompson. Congressman Huffman?
I will second all of that. I think we can feel really proud about some of the metrics that we're achieving in Sonoma County. Again, these things don't happen by accident. It's just a lot of really great professional leadership, and it includes the elected officials on this call. So thanks for being part of a cohesive team. We will continue to be frustrated, I'm sure, by the scarcity problem that is the real bottleneck to holding us back from going even greater heights. But we're going to break through that very soon. And that's a big part of, I think, the message we brought today. Let's be impatient, but let's also know that the help is starting to arrive, and we're going to get through this together.
Thank you so much. Stay safe, everyone. Be well, and don't forget that mask and that social distancing. So important from here on out. Take care.